Every business has its own unique story. Stories brewed in early mornings and late nights, built by the hands of business owners chasing a dream. Here on Business Over a Brew, we bring those stories to you. I'm Nick Darr, and in each episode, we sit down with a local business person to explore what drives them, what challenges them, and what keeps them pouring their passion into our community. Because every local business contributes more than just products or services. They're the heartbeat of our neighborhoods. They're run by people who care deeply about their community, and their stories remind us why supporting local matters. So pour yourself a drink, take a seat, and let's learn from some of the best in our backyard, right here on Business Over a Brew, presented by the Riverbend Growth Association. And welcome to another episode of Business Over Brew. I'm your host, Nick Darr. Pleased to be joined in this episode by Zach Yoder, President, OSF St. Anthony's Health Center for about a year now. Zach, thanks for coming on the show. Appreciate it.
Absolutely. Happy to be here.
Well, tell us a little bit about your background and where you grew up and just kind of a little bit of a resume for our audience.
Yeah, so interesting enough, I actually grew up in this area. I grew up in Godfrey, attended Jerseyville High School.
Okay.
I went to Godfrey Elementary, McKinley. All my schools I went to as a kid are now closed.
So you shut them all down, huh?
I've officially reached old man status. But yeah, I went to Jerseyville High School. Grew up here, moved away for college a little bit, still somewhat locally. And now have the opportunity to come back and serve the community that I grew up in. So very exciting for me.
So it's been about a year now. I guess it was January last year. You officially became president of OSF St. Anthony's Health Center. You've got a nursing background, right?
Yes. Yeah. I went to nursing school. I was originally actually pre-med. I went to school as a biochemistry major. Took my MCAT admissions test. Was doing an internship up in Cleveland, and realized pretty quickly I did not want to do this. Was around a lot of physicians and spending a lot of time there, and just realized that it just wasn't my path. But I was a junior in college at that point, so that was a little confusing for me on what I should do. And so I started thinking about, what do I enjoy about healthcare in particular? I was talking to my mother and some other folks, and they said, why don't you try nursing? You can go into many different paths at that point, and decide on either leadership or maybe you want to do anesthesia or nurse practitioner. And so I made the plunge, and within about 4 years of getting into it, or of graduating, I was kind of in the leadership track, and then just kind of took off from there.
What do you think? There's a lot of nurses, obviously. So what was it about you that you think maybe somebody looked at and thought this person should be in a leadership role, or was that something that you kind of went after?
I don't know. I think it was a little bit of both. I naturally kind of gravitate more towards kind of leadership roles. I think just in my personality, I really like to run teams. I like to build things. I like to think 3-4 steps ahead. And so I think naturally that's just kind of where my passion is. But a lot of times too, especially in healthcare, people go into clinical roles. They don't go into leadership initially. And so you kind of get tapped for things. Sometimes if you're decent at what you do, they're like, hey, you should go into leadership. That doesn't necessarily mean you're going to be good at it.
Sure. Right.
So when I started, I was like, oh man, I don't know if this is for me. But once I got into some of these clinical supervisor roles, and then I quickly got into the manager role and then director. And then after that, it kind of it took off. I really, really started to enjoy it. I found that I could be a lot more impactful with large teams of people versus taking care of a small patient panel or whatever every day. I felt like having full teams and being able to kind of grow an organization was a lot more enjoyable for me, and something that I just found to be good. So,
I think COVID, whatever it is, we talk about generations and millennials and things like that. It's changed some in terms of leadership and management. How have you seen it evolve over your years in leadership?
Yeah, it's gotten really interesting, especially in healthcare, because every year we're doing more with less. We're getting paid less, but we're doing more. We're growing more, but less income coming in. So you have to be really efficient in the way that you operate. Mm-hmm. We are definitely seeing that. And so, I think people that are going into leadership for some of the wrong reasons are quickly getting out of it once they realize that you really have to enjoy it. You have to love it. It's 24 hours a day. I mean, you go home at night, you think about the work you're doing, you come in the morning and you're full throttle as soon as you hit the ground running. So I think it really has to be something you're very passionate about and enjoy. And so I think that's really kind of separated those two folks, I think, more than ever.
It is a contrast. I've had both jobs where I had a job where it was in the office at 8, punched out at 4 or 5, and that was it. It shut it off. Like, I didn't think about it until I got back in the office until the next day. And that had some positives about it, but also, when you're in leadership there's some good things about not being able to get it off your mind and just being, I don't know, passionate about it all the time.
Yeah, absolutely. I don't know. I just always felt like connecting with people, connecting with patients, seeing people at their lowest point when they come in, and being able to impact that day in and day out, and be able to take care of our teams that take care of those patients is just something that I get a lot of self-worth from, and I really enjoy. Especially when you do it for a while, you start to see kind of the fruits of your labor after 3, 4, 5 years, 10 years, or you look back at organizations you worked at and places and see that they're still continuing to carry that torch forward is just really exciting for me. And so I've been blessed to work at some really great organizations and with some phenomenal teams. So that definitely helps, having some people that I really look up to a lot.
Most of the guests on the show are, have run smaller businesses, and you're overseeing a much larger team than our average guest and really than the average entrepreneur. So talk about how can you be efficient, being the leader of such a large team?
Yeah, so I think small or large is you have different resources for each one. So we have about close to 500 people that work here at OSF in this market. We have 26,000 that work across our OSF market in Illinois. And, for us, it's really how you leverage the team around you. You want to build a team of people that have things that you don't. And I think that's the important thing. You can really only be good at a few things, be great at a few things, I guess. But collectively, when you have a whole team, you have so many different lenses to look through that inevitably your team can handle the work. And so I think for us, it's really about, ensuring that we have that team and that we're cohesive, and that we're building a structure that we all feel valued and respected and able to do the work autonomously. And so that's important too. Being able to kind of cascade out these visions and strategies and lay things out and have your team run with certain things and trust that they can do it is really important.
I would think too, another key might be having a leadership team that reports to you instead of 35 direct reports to you, having a fewer number than that.
Yeah, for in this role that I'm in now, it's really most of our senior leadership team. So I have a chief nursing officer, a chief medical officer, a vice president of operations, and then we have our finance director, all in our administrative area. And so really they kind of report up to me. And then within those teams, they have directors, managers, and things like that. And so, it helps really kind of streamline where do the operations need to go. If you're talking frontline nursing, then you're looking at our chief nursing officer and her, 8 nursing managers and directors that she has that she's able to get the work done through those channels. And so it really makes sure that the right people are doing the right job, right? And so you don't want to overstep too much, especially in my role. I'm probably the worst person to do some of these operations things because I'm not the one doing it every day. So we have to really build up our teams and spend a lot of time growing people so that way they can be the best version of themselves.
I always say, right, the last thing you want is for the owner to get involved. That'll mess everything up.
Yeah.
So maybe some truth to that, I guess.
For sure.
Talk about you mentioned, you can only be great at a couple of things. What do you think some of your strengths are as a leader?
I think relationship building is a strength of mine. I think I value it a lot. I value spending the time with my team to really get to know them, their strengths, their weaknesses, help them, make their strengths stronger, help them minimize their weaknesses, really work with my team to do their best work. So the relationship building, the mentoring, teamwork type opportunities, that's one of the bigger ones. But I also think when it comes to the acumen of the business overall and the strategic focus of where we're going as an organization, is something you really have to look out. You have to see 5-10 years into the future on where are we going? What do we want to be? And then we have to carve our pathway to get there. It's very complex when you're looking at healthcare because you have outpatient, you have inpatient operations, you have the primary care offices, you have all your specialties. And so you're trying to grow all of these, but you're also trying to make it work in the community and the environment you're in. And so there's a lot of moving pieces that you have to be able to understand and be able to maneuver. And so I think that is another opportunity that I feel like I really drive value at for our organization. And so, and then being clinical, having a nursing degree, obviously being clinical, but then having the operations, the finance, and the strategic background and education as well helps kind of mold these things together. So you're able to speak multiple different languages because they're not all the same.
Right. Sure. Talk a little bit about just strategies, and you probably don't have there's probably not a typical day for you because they're probably all a little bit different, I would imagine.
Yeah.
Are there certain things though that you feel like you have to get done every day?
Yeah. I mean, so for me, it's people first always. We have major pillars that we focus on. We look at obviously quality and safety is one of our largest ones, of course. And then we have strategic growth opportunities. We have our patient experience. We have our employee experience. And so and then we have our finance. And so those things are obviously kind of our buckets of work that I really focus on a daily basis. But when I look at what is my one thing I need to do today, it is really supporting the team. So whether it's helping support some sort of new infrastructure, new change, new growth opportunity, or whether it's mentoring someone or I teach on the side as well. And so I do that opportunity. I have like 8 students right now in a master's program that I work through. In fact, one of the individuals that is in my class is also doing his externship at our hospital right now. And so I got to meet with him this morning, which was awesome. And so you have those kind of opportunities too. But it's ensuring that the hospital is on the right track every day. So we start our day off with morning safety huddle. So we go through, what is our census? What are our safety opportunities? All of these kinds of things. And so you want to make sure that things are rowing in the right direction, but at the same time, you're there to support the overall team. It's like a teeter-totter all day long, right? So you're always trying to make sure that everything is moving in the channels that it's supposed to move in. And that's one of our biggest things.
Every business, no matter how great it is, there are, some things that happen. Do you have mechanisms in place, like a process in place? Like, for example, if there's a fire to be put out, let's say, is there a process for how that ends up on your desk?
Yeah, usually if it ends up on my desk, it's pretty bad.
That's what I was going to say. I would imagine, yes.
And I want to keep it that way because one, we have to trust our teams to be able to do the work because there's a dozen fires every hour somewhere.
Right.
I mean, even just before I left here, our MRI machine went down, and so we have to figure out. We got to reschedule everybody. When's it coming back up? Are the individuals coming out to fix it? Obviously, that's lost time for everybody. People take off work to come in for those things, and so it's something seems very simple. It went down, but it impacts 50 people. So you have to really be like quick to react to those things.
Right.
But you also have to make sure that you're keeping calm under pressure because not everything is a fire as well.
Sure.
And so that's really important.
And even if it is, getting uber excited about it or emotional about it is probably not going to help much.
No. And I think that's one of the harder parts too, is you have to be that calm support in that moment. And sometimes you're kind of terrified as well, because there are times when, Joint Commission shows up because we had a complaint or an issue, and now you have all hands on deck because they're going to be there for 8 hours looking into all these different things, trying to find something wrong with your process. And so you have to make sure that everything is being done correctly, compliantly, safely. And so when something pops up like that, you really never know what rabbit hole they're going to go down. And so that is a fire that is obviously very emotional and a big moment for everybody. It's basically stops the day and everybody is focused on that. But those things happen very, very rarely. But when they do, that's kind of the moment you have to take charge and say, okay, well, we're going to go through this systematically. We're going to be calm. We're going to do the right thing. We know we do great work. And so we're going to get through this.
For some reason around here, and it sounds like maybe future, they happen on Monday more times than not. It feels like too, for whatever reason. We're going to take a quick break. We'll come back with more. Zach Yoder, OSF St. Anthony's Health Center president, right after this on Business Over Brew. But first, a word from our sponsor, the Riverbend Growth Association.
Nick Dar here with Big Z Media. Hope you enjoy the episodes of Business Over Brew, and pleased to have the Riverbend Growth Association as the sponsor of this program. Our missions are kind of the same, really. We're attempting to educate people about business, foster business in the Riverbend community. The Big Z has been a member of the Growth Association forever, probably back to our inception as a company almost. We have always been members of the Growth Association, have gotten a lot of benefits from it. There's so many networking opportunities you can take advantage of. I've met so many great people just because I've been a member of the Growth Association and taken advantage of all the events that they have, plus just some of the resources they provide you, the relationships you build, just lots of great reasons to join the Growth Association. They do a lot of great things in the community as well. They highlight a different nonprofit every month. So really, they're just invested in the community here, and especially the small business community, which is what Business Over Brew is really all about, which is helping the small business community, because it's so important to any community to have a thriving business community. And the Growth Association has really helped with that. If you want more information about joining or events that might be coming up, they have events all the time that you should definitely take advantage of. I'm going to give you the website to go to. Just head to growthassociation.com. You can get a membership directory. You can see who's taking advantage of it. You can see about the events that are there, learn more about possibly becoming a member. Or if you already are a member, you can find out what's going on with the Growth Association at growthassociation.com. So just again, big thank you to the Riverbend Growth Association for sponsoring Business Over Brew.
Absolutely. Thanks to the Growth Association for sponsors. Zach, a member of the Growth Association, as am I, on the board. And while we're here, I guess just maybe talk a little bit about the organization and what benefits you've seen from it.
From the Riverbend Growth Association?
Sure.
Yeah. So I love being a part of it because it gives me an opportunity, one, to meet folks in the community. A large portion of my role is also being community focused and making sure that I'm out and about supporting various things. So like I sit on multiple different boards in the area, one being Riverbend Growth Association, and seeing the stuff that they do is awesome. Like, for example, we have multiple events even last week and this week of like ribbon cuttings to go to of different businesses that are forming. And it's just good to show up and support folks in the area that are doing good things to make Alton and the Riverbend area a great place to be.
And then I guess you also have a board of your own that you're working with at OSF, correct? Talk about that relationship a little bit.
Yeah, so it's interesting. We don't have a local board. We have a community council because we have a system board.
Okay.
And so the way that it kind of flows up is each of the presidents at the hospital sit on what's called cabinet. It's a cabinet, kind of like feeds up to the board. So we get together every month. And then every quarter we're on site up in Peoria at our headquarters for about a 4 or 5 hour kind of like a board meeting, so to speak, but it's not with our board. It gets filtered up through the board. And so that's the way that we can cascade information up to the board, but in a way that makes sense because there's 17 hospitals. So you can imagine that room would have 80, 90 people.
Sure.
It would be a very fruitful meeting.
Probably not, no.
But that's good. But I have a community council locally that I talk with them all the time. In fact, one of the individuals sits on one of our committees on site at the hospital. But I talk with our community council every month. We have a morning meeting, and so we keep in contact, and then we keep in contact regularly throughout the week as well.
You mentioned always, looking at the next 5 to 10 years. When you guys are in those meetings and having those discussions, what challenges are you discussing, and what are you looking at over the next decade or so?
Yeah, so the definitely the most challenging one is all the kind of the things that are coming down from the big beautiful bill right now. With Medicaid cuts and loss of Medicaid throughout the next about 8 more years. So the cuts will go through 2034. I mean, it's for our organization alone, it's like $100 million of cuts, which we're no stranger to that. It's going to be billions and billions of dollars as a nation. And so, that's the big thing is how do you position yourself to withstand those cuts that are happening? We know that inpatient care is going to be less and less of a focus into the future. It's going to be more focused on outpatient care, specialists taking the hospital to home. We have our on-call service, our on-call van that goes around and does all kinds of different things. They go do flu shot clinics, they do testing. And so we want to bring things to the outpatient. That's really the key. And then they come inpatient whenever they really, truly need to. And when they need to see a cardiologist and go to our cath lab and get a stent put in, for example, or when they come and receive cancer treatment through Muller Cancer Center. But other than those things, we really want to take these services to them. We do also at OSF have a huge on-call center. I know we have the on-call van here, but we have a telehealth network in Peoria that sees patients all over the country remotely, and usually in like rural health areas. And so we keep people in their homes, keep people in their communities, but bring the specialists to them in areas that don't have these services. And so we have a lot of different ways in which we can bring services to people despite all of the funding challenges that exist.
I would think another aspect would be technology.
Oh, yeah.
The impact of AI on healthcare. Can you speak about that a little bit?
Yeah, so OSF, for the last few years in a row, we've got the Fortune magazine's most innovative healthcare company. And it's funny because I never knew that when I came here, but we have an on-call center, like I told you about in Peoria, that has over 1,000 people that work at it. And it is all technology. We also have a jump simulation center at our Peoria campus that focuses all on AI, ambient technology, and all of the things that we're all talking about all the time.
Right.
One thing that we just started was ambient technology for our doctors, called a system called DAX that we use. And what this does is it allows our physicians to have interactions with their patients without having to chart, because the ambient technology listens to them and charts all the information for them in the room. And so they can just have the conversation with the patient, and it will make all of their notes and everything for them to sign off on.
And I think you are getting permission from the patient before you do that in most cases.
Yeah.
I've been asked that at a recent visit, like, hey, I use AI. Is that okay with you? Right?
Yeah, absolutely. We find that most patients like it or want you to, because they want to have the human interaction.
Right.
And we've gotten to the point in healthcare where we have to chart so much and do so many paperwork and administrative tasks that we lose a lot of that focus that we can spend with them, especially in the cancer space. You got to think about people coming in and the headspace they're in, and you're sitting there with your back turned to them, typing for 30 minutes. It's not a good experience for anybody.
Sure.
And so we've had a really great success with that. That's just one area in which we're doing, but we're doing a lot in the telehealth space too, which is amazing.
Is there a balance between wanting to be the most innovative, but also maybe not jumping into things that too quickly?
Yeah, I think you have to filter everything through, who are we and what's our mission? Mm-hmm. Like, our mission is to take care of patients with the greatest care and love, and that's what we do as an organization. And so when we set out for that to be our mission, and that's what we want to accomplish, we have to put the patient first in every single interaction. And so, like, our patient experience is through the roof. We have amazing patient experience scores, and people time and time again say when they come into St. Anthony's, they feel it. It feels different when they come in. And that's because we truly care. We have a very, very engaged colleagues. We just took our opinion survey. We had 89 percentile for our employee engagement, which is huge. Out of over 400 people, to have 89th percentile in the country for your patient experience or your employee experiences shows that they're highly engaged. And when you have a highly engaged workforce, it translates down to the patients, right? If you're happy, you enjoy being there, and you feel valued in what you do, that translates down to the experience of the patient. So we put them first, and then we use the technology to make it a better experience for the patient.
So that 89% number doesn't just happen. What are some of the things that you are intentional about doing to get that number where it is?
Culture is the biggest thing, and that's the majority of what we focus on, especially as a senior leadership team, is getting the culture to a place where people can be the best version of themselves. So like I said before, we take the tasks and put it on the right person that can do it. We respect people enough to say, this is something that is your area of expertise, run with it. Mm-hmm. If you fall, if you fail, we're here to help pick you up, but we want you to have ownership in that. We get a lot of buy-in with folks. So when we do, like when we strategically plan things like that, we have work groups. We have people that get together, multiple different specialties, and we figure out, what do we want to be? Who do we want to be? How do we want to do it? And we get together and we leverage people's expertise. And so it's not me creating a strategy or me creating a workflow and giving it to you and saying, go do this work. It's us collectively making sure that we can be the best that we can be. And then we round a lot. So I round on my team throughout the whole hospital about 2 hours every week, which It doesn't seem like a ton, but I'm in about 60 meetings a week too, so it can be a little difficult. But that's a big thing. And then we have structured rounding with our senior leadership team too, where we pick specific areas every quarter that we go to. We go to about 6 or 8 of them per quarter, and we sit down with the whole team and we just have like an hour-long discussion about stuff. And then our leaders do the same. Our frontline leaders do the same. And so we're visible. We're out there in front of people, and we're creating an environment that people want to be at and want to work at. So
yeah, I mean, sounds like just open lines of communication are really a key part of it. Just everybody feeling heard, like they have a voice, and that they're being listened to.
It is, because, and then when something falls apart, let's say you have a quality or safety concern, everybody's bought into it. So they want to fix it. Like when we have a discrepancy, our whole team jumps on it and they're like, how can this be? We got to figure this out. This needs corrected immediately. And so everybody is engaged and bought in. And that at the end of the day is what keeps you doing really well. It's right. When you have several hundred people that care about something versus 10, it's a whole different ballgame.
I have to apologize. We got a little construction going on in the building as Zach and I are recording this today. So we'll definitely come back and do it again. But I have just a couple more questions for you. One, it's been almost a year since you've been on the job. Yeah. What are some areas you're particularly proud of in that last year?
I think we're proud of the improvements we've made in some of our quality and safety initiatives. You know, we just got our Leapfrog grade A safety rating, the 4th one in a row, 2 times this year. We're the only hospital in the entire St. Louis area that has this for our safety scores. We just got so CMS does a score every year of like a quality score. It's on a star rating from 1 to 5. We just got our 3-star, and we're projected next year for a 4-star. 5-star puts you in the top 10% in the country for quality, and we're expected to be at 5-star by 2027. So we're heading in that direction. It takes about 18 months to move the needle on a star, right, because there's so much data that goes into it. And then our magnet journey. So magnet is the highest level of excellence you can achieve as a hospital. It's nursing driven. But mostly nursing and physicians and everybody combined. There's 14 buckets of criteria that you have to accomplish. Takes about 2 to 3 years on average from the time you put in to become a magnet hospital till you get your survey. So we've been working on that for a couple of years now. The team has done a phenomenal job, and we were awarded magnet status 2 months ago, but we were awarded it with distinction, which means we excelled in all 14 categories. And there are only 46 hospitals in the world that have this. So that's huge. So quality safety wise, we do a phenomenal job. When it comes to patient experience, we're top 75, 80th percentile consistently, and we're 89th percentile in our engagement scores. So when you look at it across the board, we have highly engaged people that want to do the right thing, and we enjoy working with each other and excited for the future. So.
Well, Zach, with the hammering going on, I think that's a good place to end it. Yeah. Thanks so much for coming on. We'll have to do it again sometime. I feel like we could go on for a long time and talk about a lot of different areas. We'll do that in the future. So, but thanks so much for coming on Business Over Brew.
Sounds good.
Appreciate all the good work. Keep it up.
Thank you so much.
Thank you.
Thanks for watching this episode of Business Over Brew. If you'd like to support local business, first and foremost, shop local whenever you can. Secondly, liking, sharing, and subscribing to the show in whatever form you consume it would mean the world to us. To watch more episodes, visit businessoverbrewpodcast.com.